Hi, I'm Dr. Tracey Banks with Adriatica Women's Health. Today, I'm going to talk about the workup for abnormal uterine bleeding. Abnormal uterine bleeding can be a very scary thing. It can happen when you bleed too frequently every month, or your period lasts a prolonged period of time, or extremely heavy bleeding. This video is going to go over the workup to try to determine the cause. So there are many causes of abnormal uterine bleeding. It could be fibroids, polyps, anovulation or your hormones out of balance, cancer, or even precancer. And so the workup that we do when you present with abnormal bleeding is try to figure out which of those things are going on. And usually there are a few basic tests that would give us a lot of information. The first test is something called a hysterosonogram or saline-infused sonogram. If you think about a normal ultrasound, if my hands are your walls of your uterus, a normal ultrasound, I really can't see what's going on between my hands. But with a sonohystogram, what we do is insert a little bit of water inside your uterus to separate the walls of the uterus so I can see what may be hiding in the cavity. There could be a fibroid there or a polyp there. And this ultrasound allows me to see what's going on inside the cavity. Another test that we may do is something called an endometrial biopsy. That is a test where we take a tiny little tube, insert it inside the uterus, the dog wants to say hi, inside the uterus, and we get a sample of the tissue inside. This test helps us to rule out cancer and precancer. A lot of times we do both the sonohystogram and the endometrial biopsy together at the same time, and those two tests will help us rule out fibroids, polyps, precancerous, and cancerous changes. Another test that we will do is blood work. Sometimes the cause of your bleeding could be a thyroid problem or a problem with your pituitary gland. So we'll also normally get blood work when you present with abnormal uterine bleeding. In preparation for these two tests, the sonohystogram and the endometrial biopsy, both happen in the office and usually take about 15 to 20 minutes to do. They can cause some cramping. So we always recommend that you take some ibuprofen, about 600 milligrams, before you come to the office to help with that. And if you feel like that's not enough or that the test may be too much, we also offer nitrous oxide or laughing gas for relief. So we like to do these tests within 10 days, usually within 10 days of your menstrual period or the beginning of your period. So normally we'll have you call the office the first day of your period so we can schedule these tests within the 10-day time frame. Well, I hope this answered your questions regarding the workup for abnormal bleeding. See you soon. Be healthy.